is trial of early goal-directed resuscitation for septic shock. Definition. Septic shock is the most serious manifestation of an infection that occurs as a consequence of a severe system inflammatory response that led to a cardiovascular and or microcirculatory collapse and to tissue hypoperfusion.
Body's response to infection injures its own tissues and organs. Clinical criteria for diagnosing sepsis were first proposed in 1991 and last updated in 2001. But a lot has happened since. So now, a task force of critical care, infectious disease, surgical and pulmonary specialists has published the third international consensus definitions for sepsis and septic shock that take advantage of advances in the science of sepsis and the ability to test proposed sepsis criteria against patient outcomes using electronic health records data. The group defines sepsis as life-threatening organ dysfunction caused by a dysregulated host response to infection. In clinical terms, patients with sepsis have suspected or documented infection and an acute change in the sepsis-related organ failure assessment or SOFA score of greater than or equal to 2. The group recommends use of a bedside score, the quick SOFA or Q SOFA score, comprising an increased respiratory rate, alterations in cognition, and low blood pressure, to identify patients outside critical care settings with suspected infection likely to have poor outcomes typical of sepsis. Finally, they define septic shock as sepsis with abnormalities in circulatory physiology and cellular metabolism in the absence of hypovolemia, profound enough to increase mortality. The authors acknowledge that there is no reference standard for diagnosing sepsis, and that the definition of sepsis is and should remain a work in progress.
Application in nursing. A. Evaluate the state of consciousness through consistency in the use of the word, the state of tranquility, and the state of alert. B. Control cerebral tissue perfusion through saturation of oxygen and the analysis of arterial gases, maintaining oxygenation in the patient above 90%. C. To evaluate the rate of fall derived from cerebral hypoxemia or electrolyte imbalance that led to a state of agitation and drowsiness.
Sepsis. Alright, we put a lot of big stuff on it. The early goal-directed therapy and all those that you have to do not only to identify for sepsis by knowing the criteria for SIRS, knowing that sepsis is just SIRS plus a source of infection, and knowing that severe sepsis is those two plus an inorganic damage, whether it be a creatinine elevation, alpha mental status, liver enzymes, lactic, whatever it is. It's septic shock, which is blood pressure that is low despite adequate fluid hydration. Bonus points, what's adequate fluid hydration in sepsis? 30 mLs per kilo, 30 mLs per kilo. And you do it even if they have CHF history, even if they're kind of like wet, you still do it. everybody agrees that they have to give on now as the person to remove fluid, you will do it. You need to give this product one or you can use sex so that now that's early cold directed therapy. It says you gotta do a centralized, you gotta measure SVC on O2 and all kinds of other stuff. Now there's a trial that came out of the UK called the Promise trial that shows that careful care of the patient is just as good as goal directed therapy. That means that the goal directed therapy with all the steps, the centralized, the generalized, the visual all stuff, is just as good to put a good fluid. They're able to give antibiotics early, take good care of that patient. Now, having said that, so what that says essentially is that we don't have to be doing all this goal directed therapy. That all these things that we're doing are not necessarily beneficial to the patient, mainly because the early goal directed therapy studies were sponsored by the big sepsis drug cycles or something like that. So now that we go back and look at the data, which doses are the ones that really help, we find out that it's just progressive fluid hydration and early antibiotic treatment. So of course we're not going to change the therapy right away, but eventually that's going to come around to say, well, we really need to be able to set the patient with progressive fluid hydration, antibiotics early, and that's just as good as the whole early goal therapy. Interesting. That's it.
We saw 193 patients.
The person in a situation of critical illness due to side effect. My present alteration is orientation, person, place, and time. Often the manifestation goes from a state of agitation, restlessness is abroad, changes in their state of consciousness. Conclusion. Sepsis is a major cause of morbidity and the main cause of morbidity. In the critical patient, the syndrome of sepsis is an extremely complex process that leads to multiple organ failure and death. Currently, sepsis is considered a syndrome of systemic inflammatory response due to infection by microorganisms.